Welcome back to another episode of EyeWonder. Today, I wonder what the olfactory nerve does in relation with Foster-Kennedy syndrome. I'm going to draw a very quick diagram of the olfactory nerve and how it acts. So right about here, the olfactory nerve is coming in from the central nervous system, and then smaller parts of it stick through into the nasal cavity through pores in the skull, and the nose receives the particles and they get received by the nerve and then transferred to the central nervous system. And Dr. Lee has a model of the skull to show you exactly where in a 3D model those pores are.
So you can see on this skull that this is where the olfactory nerve runs, and those little tiny holes are the things that were referred to by Christopher, and this thing is called the cribriform plate. The olfactory nerve penetrates through those little holes and detects the molecules that provide the sense of smell. And you might be wondering, what does that have to do with neuro-ophthalmology? And because the olfactory nerve is very close to the optic nerve, so here's the skull, the olfactory nerves on each side, and the cribriform plate, the optic nerve is right here. And so this pointy thing is the clinoid. And so just medial to the clinoid, you can have the optic nerve involved. And so because there's not much of importance in this part of your brain, the olfactory groove meningioma can get quite large before you notice any symptoms. And because of that, it can become enlarged enough to cause pressure on one optic nerve and be big enough to cause increased intracranial pressure. The increased intracranial pressure will produce swelling of one nerve, which is called papilledema, but because the tumor is pressing on one nerve, the other optic nerve develops optic atrophy. So the combination of papilledema in one eye and optic atrophy in the other eye is what we call the Foster-Kennedy syndrome. So it's named for a man, a doctor, Foster-Kennedy. And so the Foster-Kennedy syndrome represents a tumor pressing on the optic nerve, causing compressive optic neuropathy and vision loss and optic atrophy in one eye. But because it's so big, it causes papilledema from increased intracranial pressure in the fellow eye. That combination of papilledema and optic atrophy is referred to as the Foster-Kennedy syndrome. And one of the causes of Foster-Kennedy is the olfactory meningioma.